When men reach their late 40s or 50s, they can develop different symptoms and emotional states including depression, loss of sex drive, erectile dysfunction, mood swings and irritability, loss of muscular mass and strength. Sometimes this bunch of symptoms is sometimes called male menopause. Medically, this state is false. Because, in case of women, there is sudden drop in sex hormones in their 50s, eventually it causes symptoms. But in case of men, such process doesn't happen. In men, testosterone declines gradually, but this reduction is too small. It's around 2% reduction for age of 40. A testosterone deficiency that develops later in life, also known as late-onset hypogonadism, can sometimes be responsible for these symptoms, but in many cases the symptoms are nothing to do with hormones. For example, erectile dysfunction, loss of libido and mood swings may be the result of either stress, depression, anxiety, or other pathological processes in the body such as blood vessels, atherosclerosis and heart-related problems which are added to psychological problems. This stage of life, frequently referred as midlife crisis, the person thinks that half of the life has gone. And anxiety rises, it affects job, personal life, and can lead to depression, divorce, loss of job, change career, or other important life events. Other causes of the male menopause include lack of sleep, a poor diet, lack of exercise, drinking too much alcohol, smoking, low self-esteem, and other psychosocial problems. When person gets older, rarely it can develop late-onset hypogonadism, which is caused by reduction of testosterone production. Such prominent reduction can be associated with obesity or diabetes type 2. If person is generally healthy, such hypogonadism does not happen, because it is not a normal part of aging. Important reduction of testosterone level is rare. Only 20% of men in their 60s and 30% of men in their 70s have low testosterone. Around 5% of men between 70 and 79 have both low testosterone and the symptoms, so are diagnosed with late-onset hypogonadism. Hypogonadism can also occasionally develop later in life, particularly in men who are obese or have type 2 diabetes. The significance of a decrease in testosterone levels is debated, and its treatment with replacement is controversial. The Food and Drug Administration, FDA, stated in 2015 that neither the benefits nor the safety of testosterone have been established in older men with low testosterone levels. Intaking testosterone can increase risk of cardiovascular events and stroke risk, especially in men over 65 and men with pre-existing heart conditions. Generally, normal level of testosterone doesn't contain any risk for older men. Moreover, naturally normal level of testosterone inversely correlated with many diseases, and decreases their risk. So the testosterone produced in the body has many benefit effects on the body, including decreased cardiovascular disease risk, increased lean body mass, decreased visceral fat mass, decreased total cholesterol, and glycemic control.